to the June safety meeting. Today we're going to be covering first aid, personal protective equipment, broken glassware, and fume hoods. So let's get started. In this first aid section, we will be covering common illnesses, heat-related illnesses and injuries, chemical and thermal burns, wounds and bleeding, breaks and sprains, and poisoning toxic fumes. Let's review some common illnesses. First is diabetes. Diabetes is when the body is unable to change sugar or glucose from food into energy. This process is regulated by insulin, a hormone produced in the pancreas. Bud here has diabetes. Bye, guys! Hyperglycemia happens when there is too much sugar in the blood. The person may not have taken enough insulin, or the person has ate too much. They ate too much, I think. Hypoglycemia happens when there is too little sugar in the blood. The person may have taken too much insulin. The person has eaten too little food. They didn't eat that much. The person has overexerted him or herself. Hypoglycemia can quickly become life-threatening. What to look for? Changes in the level of consciousness, changes in mood, rapid breathing and pulse, feeling and looking ill, dizziness and headache, confusion. What to do until help arrives? Give sugar in the form of glucose tablets or paste, 12-ounce serving of fruit juice, milk, non-diet soft drink, or table sugar dissolved in a glass of water. Even if the problem is hyperglycemia, this amount of sugar will not cause further harm. Better too high for a day than too low for a moment. Buddy Boo, so cute. Now let's take a look at seizures. A seizure is a result of an abnormal electrical activity in the brain. It causes temporary changes in the body movement, function, sensation, awareness, or behavior. Epilepsy is a chronic seizure condition. What to look for? A blank stare, a period of distorted sensation during which the person is unable to respond, uncontrolled muscular contractions which last several minutes. What to do until help arrives? Do not try to stop the seizure. Do not hold or restrain the person. Make sure that the environment is safe, like there is no acid around. Protect the person's airway. When the seizure is over, make sure the person's airway is open. Roll him or her on her side. After a seizure, the person may be drowsy and disoriented. Check for injury. Stay on the scene with the person until he or she is fully conscious and aware of the surroundings. When to call 911. The seizures last more than 5 minutes. The person has multiple seizures. The person appears to be injured or fails to regain consciousness. The cause of seizure is unknown. The person is pregnant or has diabetes. Or it is the person's first seizure. Now to cover what we do for an unconscious person. Know the 3 C's. Check, call, care. Check. Does the person have an open airway? Is the person breathing normally? Is the person bleeding severely? Check out the environment like there are no acids around. Call. Call out for help. Chip, Brenda, Aaron, help! Call 911. Care. Care for the victim if you feel you have the skills necessary. Always care for life-threatening emergencies by checking for breathing and bleeding. Remember, don't move a victim if you suspect any possible bone or spinal injuries. Let's look at heat-related illnesses and injuries. Heat exhaustion is more severe than heat cramps. What to look for? Cool, moist, pale, ashen, or flushed skin. Headache, nausea, dizziness, weakness, and exhaustion. What to do? Get the person out of the heat by moving them to a cooler environment with circulating air if possible. Loosen or remove as much clothing as possible. Apply cool, wet clothes, such as towels or sheets. Remoisten the clothes whenever needed. Spray the person with water and fan them. Give cool liquids only if the person is able to swallow. It can be water, milk. Do not let the person drink too quickly. 4 ounces every 15 minutes is recommended. You shall call 911 if the person's conditions does not improve, if the person refuses liquids, if there is a change in consciousness, or the person vomits. Heat stroke is the most severe heat-related illness. Heat stroke develops when the body's systems are overwhelmed by the heat begins to stop functioning. Heat stroke is a serious medical emergency. 911 should be dialed immediately. What to look for? Extremely high body temperature, red skin that can be either dry or moist, changes in consciousness, rapid weak pulse, rapid shallow breathing, confusion, vomiting, and seizures. What to do until help arrives? Quickly cool the body by putting the person in cold water up to the neck, or soak the person in with cold water. Cover the person with ice or soak towels over the entire body, frequently rotating them. Cover the person with bags of ice. If someone does have an open wound, cover the wound with a sterile dressing. Apply direct pressure until bleeding stops. Cover the dressing with a bandage. Check for circulation beyond the injury. Call 911 or go to the local express care if the bleeding does not stop. Apply more dressings and bandages and continue to apply pressure until medical attention is received. Moving on to wounds. A puncture or a deep cut that can result in tetanus. Tetanus is an infection caused by bacteria that produces poison in the body. The poison enters at the nervous system and can cause muscle paralysis. Tetanus can be very dangerous and even fatal. You can prevent tetanus with immunization and can get closer booster shots every 10 years. You may also need a booster if your skin is punctured or cut by an object that carry infections such as rusty nail. How to apply a bandage. Do not cover finger or toes. Check for feeling warmth and color of the area below the injury of sight, especially fingers and toes, before and after applying the bandage. Secure the end of the bandage in place with a turn of the bandage. Elevate the injured body part only if you suspect that no bones have been broken and only if so does not cause more pain. Apply additional dressings and other bandages if blood soaks through the first. Do not remove blood-soaked bandages dressings. Stitches may be necessary if the edges of the skin do not come together, the cut involves the face, any wound over 1/2 inch long, wounds with uncontrolled bleeding. Bye. Ow! Now I think it's a good time to start talking about breaks and sprains. Remember the acronym RICE. Rest, immobilize, cold, and elevate. First, rest. I'm not going to move. Immobilize. Minimize movement. You can use a splint. Cold. Apply cold packs, leaving a barrier between cold and bare skin. Elevate.